but the number could be much higher than that or much lower. I think that there's more volatility in possible outcomes than is typically the case. And the markets are just watching this number with absolutely intense interest.
So Nathan, one of the mysteries for me, and you're an economist, so I hope you can explain it, is we've got GDP growth that is just gangbusters, and it looks like it's going to keep going for quite a while. There are lots of positive indicators about what's going on in the economy, and yet we have a lot of jobs going unfilled. At the same time, we have a lot of people out of work. Why aren't people taking the jobs that are available?
I think the answer to that question is myriad. I think there are probably 100 different factors at work. But the key question in my mind in this regard is
All right, folks, good afternoon, and it is that time of the week. This is the Marketplace Show Reset and Jumpstart. I'm Anthony Weeks, and I'm joined by my colleague, Linda Dorman. We're broadcasting live on WSDX Radio. We're also broadcasting live on La Mega Mundial. We're also broadcasting live on Caribbean Passport Magazine. We're also broadcasting on Tempo Network Television, and we are broadcasting on the Kalalu Network. Again, I'm the executive producer of the Kalalu Network, and we are delighted to come before you this afternoon. As usual, we have a full pack show today. We're going to cover a lot of grounds today on the program, but in particular, the month of June symbolizes and commemorates the commencement of our Caribbean Heritage Month, but May 31st hallmarked the 100 years of the Tulsa Massacre back in 1921. And of course, June 19th is known as Juneteenth. And so the month of June is a very significant month for people of color in this country, particularly Blacks in this country, because it speaks to the economic status of Black American, Black folks in this country, and as well as other people of color, Latin folks as well. And we've seen the vulnerability, the inequalities, the disparity in terms of those who are most susceptible to chronic illnesses, and the fact that the pandemic, COVID-19, has really impacted the minority community, and it really exposed the weakness or the disconnect in the healthcare space as it relates to people of color. And my colleague Linda Dorman is someone from the health industry. On this segment called Wellness and Health is which she produces and coordinate the invited guests. We have two very special, exceptional persons on the program today. These are two registered nurses who are very active on the front line of COVID-19. Linda, I want to thank you for, as usual, doing a great job in producing and arranging for topic of discussion and the guests on the program. And just want to say hi and acknowledge it is a beautiful day. It's a beautiful day in the neighborhood. And I hope where you are, it's a beautiful day as well. How are you doing?
I'm doing great, Anthony. You just inspire me so much when you give that amazing lead in. And you're right. We have a lot to celebrate in June. We have a lot to celebrate in terms of our heritage and our history. And we have a lot to reflect on as we obviously put the stepping stones towards our future in place by not forgetting our past, and that is what happened in Tulsa, Oklahoma. I have an amazing project there, and I'm really excited and look forward to announcing that in terms of restoration of a historic hospital that sits right there inside what we knew as, what we now know as Black Wall Street. And that entire hospital burned down along with all other businesses in the massacre. So I'm pleased to say that I'm affiliated with a project that's rebuilding portions of that, as well as rebuilding the community around economic development. And so right here in our own backyard, the DMV, we have a lot of still rebuilding to do post-COVID. And I'm so pleased to have Yvette Wood and Sonetta Curry on our show today, because these are women who were front line. I mean, touching, feeling, seeing, working with patients, working with young people in the school system. And what I'm so proud about them is that they are entrepreneurs. They have figured out a gap and they're filling that gap. So we're going to talk about their experiences as nurses, what it was like being on the front line. What do we need to do now? Because we're we can't be out of the fight. We have to still be in the fight. And they're going to give us some real good, strong advisements and clues and tips. And we're just going to have a good conversation about what they're doing in the DMV that's in response to COVID and beyond COVID.
Yeah,
but you're
absolutely.
right. It's a beautiful day in the neighborhood and weather's good.
Absolutely. And just before we bring in our guest to the program, in segment 2 and segment 3 is where we'll provide a special report on the Tulsa massacre back in 1921.
Yeah.
And it's interesting to look at the dynamics of why Tulsa, Black Wall Street, Greenwood was such a success. And it's interesting how we've always applied the word segregation in a negative way. But the reason why Greenwood prospered as a predominantly Black community was because they were predominantly Black, and just about every segment of the community and population basically were run and controlled by Black Americans. And that allowed them to circulate the dollars within their community. Once integration started, what it did basically, it allowed the monies that was generated to start leaving the community. And so, it's interesting when you look at the word segregation, integration, how they have an interesting sort of inverse relationship, if you will, or adverse relationship, if you will.
Exactly.
But certainly we are seeing the vulnerability, the gaps, if you will, because the light that had been shined on that issue of people of color is the health crisis, and showing the haves and have not and who's been most impacted. So let's bring up your guests on the program, and let's get
with it. Let's get into it. But you know what? Also, I wanted to say on that note, and those are very good points, is that while we know about the massacre in Tulsa, Oklahoma, and we've given it the Wall Street name, let me say this: there were other Black Wall Streets across the country, in North Carolina, in Florida, in Louisiana, that also had very, very, very successful Black townships in which that Black dollar was circulated, because those are the resources that we could rely on. And those were also raised as well. So we have to think about it from totality. So look who's on the line.
And in today's, to be looking at the reality of the situation, the U.S. Virgin Islands, where I'm at, the U.S. Virgin Islands is predominantly Black, people of color, right? 70-something% of the United States Virgin Islands is predominantly Black and Latin. Same thing with Puerto Rico, predominantly Hispanic in Puerto Rico. We're both U.S. territories. And so if there is a current day, modern day example of how we're not states, we're not a state, either one of us are states in the United States, but these are community that are literally predominantly people of color. And so the question is, how can the Virgin Islands, how can Puerto Rico and the rest of the U.S. territories can take a page out of the book of Greenwood, Tulsa, Oklahoma, and learn from that and see how we can apply that going forward. I just wanted to be able to lend that to the conversation.
Well, yes. In our, welcome to Wellness Wednesday. We talk about this from the economic standpoint, but there's health disparities, and and Sonetta Curry and Yvette Wood know that all too well because they are professionals who work on this front line, and I know them to be amazing, amazing businesswomen. Welcome to the show, ladies. Sonetta, you're on. Can you mute your mic so everyone can hear your beautiful voice? We know you have a lot to say, so you are muted at the moment. But welcome to both of you. Yvette, how you doing?
I'm great. Linda, how are you?
I'm doing great. And Sonetta, she's working her way in. This is live, so we know that we have technical challenges every once in a while. But listen, I want to just give our viewers and our listeners a little bit of a background about you, because I could spend a full hour just giving your whole dossier, because I know you to be an amazing dynamic woman of God, and all that you're doing, both you and Sonetta, in our local DMV area. And like I said at the top, I'm so proud of both of you for starting 5 legacy groups. So I'm going to read a little bit. So I'm going to start with you, Yvette. Yvette Wood has over 10 years experience within the biotech and pharmaceutical organizations in our community and across this nation as a clinical nurse educator, regional trainer, patient service manager, and 15 years experience as director of nursing. She has managed large multi-territory states and have launched a new product, patient assistant program, systems process implementation, and training business called 5 Legacy Group. You have built teams across this country in the areas of mentoring and leadership and analytics, and you have just done an amazing job at bringing all of those skill sets into this new venture that is going to fill the gap in both the travel nurse, the local nurse, and the home health services. And we appreciate that. So welcome very much. And so, hi, Sonetta, you're back. How are you doing today?
Yeah.
Can you hear us?
Yeah, she's having major connection issues.
Okay, well.
Yeah, can you turn off your camera and just use your microphone, Sonetta? And just it's because you're having video issues.
That's the beauty of live technology. We're live. We just do what we have to do. So let's just start out. And then Sonetta, let me just share a little bit about Sonetta, who works very extensively with our most vulnerable population, and that is our youth in Baltimore. Baltimore is a very troubled community as it relates to crime and drugs and just disparities in a number of social service areas. But it is a rich city with a lot of hope and a lot of good things that we have there in terms of our medical system and in terms of a lot of our municipal services and our building. Our corporations are there. I know that McCormick. Anybody love the spices? Right outside of Baltimore. So Sonetta works directly with our youth in the behavioral health arena. And this is really, really critical. Did I give all of that? Are you there, Sonetta? Okay, she's still plugging in.
Yeah.
So,
can you hear me?
We can hear you beautifully. We can hear you, and we can see all your beautiful photos. So you're good. You're on the show. You're live with us, and we appreciate it.
Yeah.
So let's just start out by first telling us a little bit about your new business, because I know this fills an important gap in what we're talking about today, and that is being on the front line and talking and supporting patients and giving us a great sense of guidance as to where we go post-COVID. So Yvette, you want to share a little bit about 5 Legacy Group with us?
Sure, Linda and Anthony, thank you again for having me. 5 Legacy Group was born out of a need that came about that I really recognized during the COVID pandemic. When COVID first started, the big crisis, I'm a member of the DC Medical Reserve Corps as well as the Maryland Medical Reserve Corps. So we were out there on the front line swabbing everybody from day one as soon as we figured out what it was we were doing. And I was also the clinical director for Volunteers of America. One of the
Yes.
things I noticed that when staff started getting ill from COVID, it left a gap in my staffing for my nurses because my nurses were dropping like flies. And I'm like, oh my God, how am I going to keep this going? So when I called the typical nurse staffing agency to get someone to come and replace my staff, they didn't have any, or they wanted an astronomical amount of money because of COVID. And it became increasingly difficult to get people to come and work. But one thing I did notice that when I started changing what I was offering, they started biting. So I
Awesome.
thought, this is interesting. So working from home as well became comfortable for nurses because there are administrative nurses that are not hands-on that can work from home. So I decided to look at it and combine the best of both worlds. So with Five Legacy Group, what we do is we offer medical staffing. It's not just nurses, it's doctors, physical therapists, occupational therapists. But my incentive to get the nurses on staff was to, one, give them daily pay, because a lot of them need their money. They can't work, every day because the schools are now closed. Some of the schools are still doing virtual or hybrid learning, but they needed to get out and work and they needed to make money instantaneously. So we're offered daily pay. I also offer flexible scheduling, so they don't have to work full-time or part-time. They work when they're available to work. They work weekends, they work nights, they work holidays because of all of the religious differences and personal preferences, honestly. So when you're offering a flexible schedule with daily pay and different areas of expertise, if you are a travel nurse, then we, send you to Colorado. If you're a pediatric nurse, you may work down at MedStar in DC. We try to specialize for that person. So our services are customized for the client as well as the employee.
Wow, that's a lot. So what's going on in the nursing industry? Because isn't it true that the nurses represent as a workforce somewhere greater than 50% within any hospital system? Is that a general statement, too general, or is that just about relatively true? In other words, they're very critical to the healthcare system.
Yes, nurses have always been the backbone of most health institutions. Unfortunately, right now we are experiencing a nursing shortage. A lot of it has to do with motivating people to become nurses, looking at the expense to become a nurse. I just actually sent a letter to our governor here in Maryland, the great state of Maryland, asking for free tuition for people that wanted to become nurses. We have to look at different ways to help the shortage because what we're doing is not working. And if it's not working, then you need to change it. So nurses are pretty much like the housing market, the seller's market right now. They can come in and name their price. They're like, I want $70 an hour, 4 weeks of vacation, and you're going to have to bite if you need a nurse.
Do you think that this is the same situation globally? Are we just, did just COVID just bottom out this industry in such a way, or this has been systemic for several years now? Because as you mentioned, recruiting nurses through schools or other incentives, or just, what do we do? How do we do this better? But is this something that's more universal? Because in the healthcare system that I worked in, we recruited nurses from as far as the Philippines and as far as different parts of Asia, parts of Africa, build memorandums of understanding because the nursing shortage was just so dire. Trying to figure this out.
Right. It is a systemic issue, and it has been for some time. But what COVID brought about in the nurses was, oh my God, this is real. I can lose my life being a nurse. We sign up to save lives. We never realized we could lose our own. And COVID made that a reality for a lot of nurses. So some people actually changed positions. And there were some that changed out of the nursing field and some that went into different areas of nursing. For instance, I did an interview about a month ago with WTAE, I think it was in Pittsburgh, about nurses on the front line and in administration. The ones that were in the office never got COVID. Those that were doing bedside nursing were the ones that got COVID. So, of course, as soon as they could, they got off the bedside and went into administration because no one really thought, this is not the Army. I did not sign up to say, to lose my life. But I remind nurses, yes, you did.
Yeah.
Yes, you did. We signed up to sacrifice ourselves at any cost, just like a soldier or a Marine, because you're there and obligated to provide health care under any circumstances. You know, that's like the Medical Reserve Corps. I get called in an emergency situation. Thank God we haven't had any more 9/11s, but you are on the front line, and that comes with a price.
So
So
this is-
if I can jump in, Linda, because I mean
Sure.
I'm trying to listen, and I'm Sinette Curry's on the program. Her video is not on, but Sinette, you can hear us, right? You can participate. You there, Sinette? Yeah, your mic is muted. Your mic is muted.
Your mic is muted again, because
Yeah.
Sinette works in a very critical area of nurse response as well.
Yeah. Sinette, can you hear us? Your mic is muted.
Well,
Okay.
Anthony, as she's working that out, what's
Yeah,
your question?
yeah. She should try to not use her video. Just use your mic, your
Oh, just-
microphone only.
There you go.
Okay, and then see if you can speak. So just jump in anytime you can, Sinette, when you like. What I'd like to, I'm a little bit. It's a head scratcher for me as I'm listening to Yvette Wood describe the field, the profession, and is it me? But if you're going to pursue the career of health and saving lives and being exposed to just about everything one can be exposed to in terms of illnesses, why would nurses don't believe that their health or their life can be at risk? Because if I believe medical medicine is considered a hazardous a profession, isn't it?
It is, but up until this time, we've been able to manage it and protect ourselves. This was the first time in a long time that we had a disease process that we didn't know how to manage or effectively protect ourselves. Even once they learned how to protect themselves, they didn't learn how to do it properly. That's why you saw so many nurses in New York originally dying from COVID, because no one took the time to figure out, okay, you have this PPE, but there's a process to how you adorn it and how you remove it. It was discovered later that most nurses contracted COVID in how they removed their PPE because it wasn't removed correctly.
Or the recycling, if you will, right?
The recycling of it.
The inventory shortage, right? And then obviously, all the things that, like you said, you just didn't know that was really putting you at great risk on the front line.
Correct. I mean, it's if you're taking care of a patient with cancer and you have, a chemotherapy can be very toxic to someone that doesn't need it. So in handling that, we understand it. So we know to put it in 3 bags and have on double gloves, and we put on our gowns, and we stay away from the chemical that we're actually infusing in someone's body. With COVID, we just did not have that knowledge. And so therefore it had a devastating impact upon the nursing community.
And is that because we've had epidemics? So is there what we call continuing operation plans that just could not be implemented in this situation because it was the volume of patients? Or are those plans now being developed in hospital systems in response for the next pandemic, God forbid, but to be in a position to more adequately respond to any surges that may come out? Because now we have ripped off the mask. If you've had your vaccine, we have the CDC's guidelines around being able to go into just about any establishment if that establishment doesn't have that policy. And here in the DMV, we received our notice last week that we are mask free if you have been fully vaccinated. That's scary. So what is the policy now? What's happening with that level of preparation in these hospital systems that all too well?
Well, let me back up and say some of this was strictly political, because the previous administration, previous to Biden, previous to Trump, this would have been the Obama administration, had a pandemic plan. It was totally ignored during the Trump administration. So the hospitals were underprepared for this type of pandemic because no one looked at what do we have in place. So then the hospitals, because it was so downplayed, that the hospitals just did not take it seriously. And that was the same thing with nurses with their PPE. Oh, I'm taking care of someone with COVID, but I'm just going to take my mask off and I'm going to take a phone call and put my mask back on, not realizing that cross-contamination could be fatal. So it was just a lack of knowledge and total unpreparedness all the way around, because there are pandemic plans. Every hospital has a pandemic plan. Our government has a pandemic plan. Even my business has a pandemic plan. You don't have one, you should have one. This is one thing I think everybody learned from COVID. Be prepared for the worst.
That's a very good point.
And I'm glad that you said that, because I mean, obviously I didn't, it's not like I'm picking on nurses. I didn't mean to seem like I'm picking on nurses.
Don't pick on nurses. We love nurses.
Of course, or just medical professional, period. I just think you kind of go into something knowing what you're in for, what you're getting yourself involved with, right? So that was a little bit odd to me. The hospitals. Okay, let's talk about the hospitals. So the hospitals themselves, I was really surprised how ill-equipped the hospitals were for crisis management, in terms of just really where they were literally kind of caught, just wasn't ready for this huge influx of patients, ill from COVID-19. And is it like you kind of get comfortable after a while? There's no crisis, there's no pandemic after every 100 years or so. Therefore, you kind of just become complacent, and you don't really believe something like that will happen. And that's how these things happen. I mean, how is that even possible?
I think, you know what? I believe what you're saying, Yvette, that, we start with the political, and therefore the information distribution was in such a state that if the hospitals really are looking at their local community and their local government is not absorbing this information and transmitting it as a state emergency, because we have not put it out as a national emergency, what are we to do? I mean, there are hospital systems, I'm sure, that really thought about this and looked at their pandemic plans and their epidemic plans, and started implementing. But then large hospital systems like New York and like our local DMV, we have it seems like so many hospitals in the greater Washington metropolitan area. We should have gotten our hands around this even sooner than what we did. But I agree, it's very difficult. But
look at Columbine, the massacres, the shooting, the preparation for a mass shooter, an incident like that. What happens is you're prepared to take half your patient load to another hospital. You'll have 50 ambulances show up, and they all know which hospital they're going to because they know what that hospital can handle. In the case of COVID, everybody got an influx all at one time, and we just simply were not prepared, nor did we have the manpower and the staffing, nor did the nurses or the doctors have the knowledge, and the knowledge kept evolving. And as the knowledge kept evolving, we got better. So this was a learning experience, even with PPE, which we should have had tons of PPE. You would think, a superpower country would have everything you needed. I was passing out expired PPE to my staff because that was all I could get. And it was coming from the government.
Wow. And I remember, Yvette, when you were the clinical director, volunteer director for Volunteers of America, which is a national organization that provides clinical services to those who are underserved. I remember you sharing with me that there's an expiration date on this type of equipment, and that was an impact. And you having to make a decision around, do I use an expired 3M mask, or do I continue on with at least some minimal protection? Those are the kind of frontline decision making that seems like we're out, not only on the front line, that we're in a war, and we were in a war.
Absolutely.
So yes. My goodness gracious. Well, I don't know. Sanetta, she's just having some serious technical problems because to talk about
her microphone is not muted, so maybe she can try and speak, and let's see if we can hear her.
Yes, because there's a Zanette, can you go ahead and speak out and say hello? You might be saying hello, but we can't
Yeah.
hear her.
Yeah, unmute your microphone if you can. Yeah, go
Yes,
ahead, Carolyn. Carolyn, go ahead.
No, you mean Linda?
I'm sorry, Linda. Go ahead, please. Sorry about that.
So listen, tell us a little bit more about some of the things that you're finding as you staff up and recruit for, and as individuals or hospital systems and clinics and medical services are looking for individuals within your services. What are some of the major issues that you're running into besides recruitment?
The major issue is still a concern for contracting COVID, and that's on the employee end. On the client's end, has this person had COVID, and are they willing to work in a COVID unit or around COVID patients? Because now some nurses are refusing, well, I don't want to work if there's going to be COVID in there, or I don't want to work in a COVID unit. And I have to explain to them, you don't have a choice, because we can't control that. Once you step from, Five Legacy Group into MedStar or whatever hospital it is, you're pretty much on your own. It's a risk that you take. And so then you have to kind of take them back to nursing 101. This is what you signed up for at all costs. We can't control what it is that you can contract. And I tell them the flu is still killing people.
Yeah.
If you get it. I mean, we just kind of focused everything in on COVID, but there's still other diseases that are taking people out of here that are just as serious. So it's just a matter of putting them in remembrance as to why they became a nurse.
So then how do we support the nursing community? And I know that you staff for beyond nurses, but when we think about that greater than 50% of a workforce in any particular hospital system is those within the nursing discipline, bedside and administrative, what do we do? What can we do to support this particular industry as would-be patients, hopefully not, but would-be patients, as advocates, as policymakers, as educators? What would be some of the top things that we could do that you would be able to share with us?
Linda, my platform, when I'm asked to speak here lately, is called Customizing Culture. If you look at Google and Yahoo and LinkedIn, when you visit those places, they have customized a culture that makes their employees want to go to work. It's comfortable. The benefits are amazing. Why is it that a nurse has to walk around and have a Coke and a Milky Way for lunch, but a computer tech at LinkedIn walks into this amazing food court with all these choices for free, and they can even go on weekends and eat for free? They can bring their laundry to work. There's nap pods. There's water fountains everywhere. Why is it that nurses are not treated that way? Why do we think that because you are a medical professional, you have to accept what we give you? You walk into a typical hospital, it's a white drab wall with the nurse's station in the middle. You smell disinfectant everywhere, and it's not an environment that's conducive to wanting to come to work. So I am trying to push a platform for medical facilities and institutions to customize your culture. Paint the walls lavender, give us some soothing music, move the nurse's station out of the middle of the floor so people are not gawking at you. Give nurses a room where they can take a break. I mean, my God, if you go in at 7 a.m. and you're still there at 11 o'clock at night, who more needs a nap pod than a nurse? Not a computer. Yeah. A nurse needs to be able to take a break and just breathe. Why not give them free lunches? Nobody wants pizza day on Friday. They're not giving them pizza day at Google and Yahoo. They're giving them great meals. So I am encouraging healthcare professional and facility owners to customize a culture that is conducive, that makes the nurse want to come to work, that helps the nurse while she's at work, that she can take and look at her child on the computer at school. You know, all the daycares have computer cameras, and see how Johnny's doing while he's at school, and not say you can't carry your cell phone on the floor. You can't have any contact with your family. That was something else that was devastating for nurses during COVID. We had no contact with our family, because if you take those masks off at any time, you're making yourself more prone to infecting yourself. So you had a very little contact with your family. But I went into LinkedIn and I went on every floor as a guest. And I'm like, well, this is amazing. They're sitting in windowsills at the Empire State Building and walking around with their computers. And I'm like, wow, why haven't we done this for nurses? Why have we not created an environment that is conducive to their health as well as the patients?
Wow.
The patients.
Yeah.
And isn't this evidence-based? When I worked at the healthcare system, we have a new $563 million hospital that's opening up not too far from my home, right here in Prince George's County, and had the honor of serving on the committee that looked at evidence-based research around creating that conducive, that healing environment, both, obviously patient-centric, because that's the person walking in the door and those who are receiving services, but also for the workforce. And I don't know how prevalent this is, but what you're saying reminds me of that, because we did pick out the lavenders and we picked out the soothing greens. We called it bringing the outside in, the artwork. I mean, we literally looked at artwork that was supposed to be, if you mesmerized and saw it all day long, it was going to relax your mind. There was all the evidence based relating to that. What's going on that we haven't made that consideration? Is it just pure money, or just someone has not determined and has not looked at the science behind creating that type of environment actually produces a better employee, particularly in our healthcare system?
Absolutely. I believe they have not looked at the science behind it. There was a move in nursing homes some year ago called the Eden theory, and they were Edenizing everything. And that means if you had a person in a long-term care facility, they were putting plants everywhere and bringing in goldfish and even putting daycares inside so that the geriatric population could watch the children play, because they found that it not only soothed them, but it was healing to them. It brought life. They didn't feel like it was a place they went to die. They felt like it was a place they went to live. And so that took a little time for that to catch on. But now if you go to these beautiful retirement communities, you see it everywhere. So hopefully now that this movement has started, and I'm glad to hear that, it will catch on. When I spoke at a conference last week, there were some nurses on there from Saudi Arabia, and they were like, wow, Yvette, we barely have uniforms, and you're asking our hospital to give us all this stuff. And they were like, we agree with you, and it's awesome, but not going to happen over here anytime soon. I mean, because they're an oppressed area, especially even for women still. But I think that this hospital that's got the lavenders and the greens, they're on the right track, because if nurses are healthy and they're happy, that moves on to their patients. Patient outcomes, it has a lot to do with the nurse that takes care of them. You got a nurse that goes in and she's like, good morning, how are you? I'm here to take care of you. The patient immediately perks up. If you have a nurse who's disgruntled, and the patients feel that too. They feel like, well, I'm a burden on her, and I don't really want to do that. So then the patients become introverted, they feel sad, and it slows down the healing process. So nurses can impact a patient in different ways than providing care. Just like a nursing shortage affects patient outcomes, because if you don't have enough nurses to provide good care, the patient population suffers as well.
Wow. Anthony, you had a question, or are you trying to take us to commercial?
Yeah, we do need to take a break, long overdue. But when we come back, I've always understood the medical profession is a noble profession. It's a very a prestigious profession, and highly regarded, right? And so I'm listening to you, and I'm like, so if that's the case, why is it being treated the way you're describing it? It's just kind of odd to me. When you think of doctors and nurses, you guys are highly regarded. This is not like, down the if you will the ladder of professions. You guys are up there, and I don't understand how is it that you're not treated the way you should be treated, because you're such a highly regarded profession. And I don't know, maybe it's just me. I don't understand What about unions? I mean, don't you guys have unions that hold the admins to the feet to the fire to make sure there's a certain standard? Or is it because, like teachers and nurses, that it's more of a social economic, a social impact institution, as opposed to technology, where they're strictly, sat on, it's about the profit? Maybe that's what it is, the capitalistic side of things. Maybe that's what the reason. I don't know. When we come from Craig, we can continue.
There's a whole lot in that. And I mean, that's layers of questions that are very relevant and extremely important, because I know one thing.
It's very perplexing.
It's very complicated. We as potential patients, and thank goodness we're on the other side of the hospital walls and doors. But if we walk into that hospital, or we walk into that clinic, or we even walk into that doctor's office, we want to know that
I'm putting my life in your hands. So what kind of craziness is this? I'm trusting you with my life.
We want you to be happy, and we want you to be productive. We want you to be present, and we want you to be awake.
Absolutely. But if you look at how America has a lot of things backwards, right? If you have a baby, right? And I'll talk quick. I know we need to go to break. That nurse is with you all the way until you crown, to that baby's head is about to birth. Then you pull the physician in for all of 10 minutes to just pull the baby out, cut the cord, make sure the mom's all right. The doctor's gone again. It's that nurse that is there all the time. So look at the political arena. We pay our president less than we pay somebody to run a basketball down a court. And nursing is no different. It's another profession where we got it backwards. It's the nurses that take care of you, who has your lives in their hand, and they should be paid for what they do and for the sacrifices that they make. I tell nursing students that come up under me, I can teach you skill, but I cannot teach you compassion. And if you don't care, I would like you to leave my class right now, because you're not a nurse. I became a nurse because I care, and I wanted to make a difference in somebody else's life. I wanted that person to know for that particular day that somebody cared for them. And so until America can figure out that nurses are the ones who truly care, we will have this argument.
All right, so when we come back, I got to tell you, I'm really, I would have really liked to hear from Sanette, but we can always do a follow-up with this, because a lot of what I'm hearing from you is very concerning for me, and I want to be able to see what we can do as an organization to help you move the ball forward as well. And you guys shouldn't have to be going through this. This is just ridiculous. I don't get it. But we'll take a quick break, and we'll be right back. Okay.
Thank you.
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and colleagues. In the wake of COVID-19, our small business community desperately needs our help. We must do our part to help our local communities to once again thrive. We must focus our attention on the small businesses that are the fabric of our great nation. SureUp is a network of small business owners, their employees, and local consumers all working in unison to support each other. By creating incentives for consumers to think local before considering regional and national providers to fulfill their needs, we create local job opportunities and rebuild our communities. In addition, through AI-driven tools and machine learning, in just 5 minutes a day, SureUp assists business owners in improving their social media presence, which enhances their visibility among consumers and levels the playing field so that local businesses can better compete with large, name-brand online competitors. When local businesses leverage the SureUp platform, full-time and part-time employees, whether W-2 or 1099, are rewarded with a variety of voluntary perks and member benefit options. These include discounts on the things people do every day, access to low-cost, subscription-based telehealth and teletherapy, discounted prescription drug plans, connection to exclusive Prosper resources, and so much more. All for less than the cost of a cup of coffee each day. The Jumpstart Marketplace is here to support the health and wellness of individual employees, as well as the health of businesses in the local communities in which we live and work. We're all in this together, so join us as we reinvigorate our local community and improve the physical and financial health of working America.
We're back, and this is the Marketplace Show Reset and Jumpstart. And we have a couple minutes left. We have a special guest on the program today. Getting some feedback. Someone has their speaker on. Yes, so we have our special guests, the folks from the 5 Legacy Group. These are 2 registered nurses who are clinical leaders during the, as they put it, the war against COVID-19 in this pandemic. And we're having a great conversation with, I'm just blown away, to be honest with you. I can't even hide it. I just can't lie, by Yvette Woods in terms of what she's describing in terms of the industry. And something has to be done. It has to be, we got to change the culture of that industry.
Yes.
And so, you know, I think you've given us a charge, Yvette, to be able to say, how can we partner with you to make a difference, you know, to be able to innovate and make a better quality of life for medical professionals, to be proud of the business they're in, and to allow the public to feel a sense of confidence and trust going in that they're going to be taken care of by people who are at a peace with themselves in terms of the care that they're delivering to the public. You know what I mean? So, but anyway, let me shut up. I'll let you.
But you know what? You just said something, Anthony. I think that I, as a patient, potential patient, walking into a hospital, I automatically have a sense of confidence. I really do, unless there's a particular rating or reputation of that particular healthcare system. I think what I want to do is not have an assumption of that confidence, because we know now, Yvette, you've given us a great education as to what we need to help advocate for this particular industry. We need to advocate and write letters to the hospital presidents, the boards, to, you know, the nursing associations, to continue to support and change the cultural environment. That's the first thing. And the second is, how do we encourage young people to consider a career in nursing, in the clinical field? Because while nursing is, you know, as a registered nurse and nurse leader in your field, and trainer and mentor and educator, and now businesswoman, there are other clinical positions that people can hold that you're saying are also understaffed. Is that correct? Are we seeing the hospitalists? Are we seeing doctors? Are we seeing, you know, administrators? What's really happening across the whole landscape of the medical field?
This is true. I mean, I think COVID kind of took its toll on the medical community as a whole, because it affected everyone. Think about it. If you're in a hospital for knee surgery, you're not going to just see the doctor and the nurse. You're going to see the physical therapist. You're going to see the occupational therapist. You may even have the dietitian in there. Everybody that came in your room has now been exposed to COVID. And so that's why this was such a great impact, because there was just not one pocket. It was every pocket in the hospital staff. We were just totally understaffed all across the board. Some people realized doing that, you know, maybe I wasn't quite ready for this, or maybe I wasn't cut out for this, or maybe I wasn't willing to make this much of a sacrifice. So let me do some other type of nursing or physical therapy. I know I was telling with someone the other day that they said, you're back out in the field. I'm like, oh, yes. They were like, oh, I'm not going back out.
Oh, wow.
Because they don't want to take that risk. And this was kind of funny because, you know, while we're doing this business, I'm still doing some contract work, and they called me and wanted me to go to Cherokee. And I'm like, oh, I don't do TPs. I don't do TPs, because in that TP, they're coughing and smoking, and I'm thinking it's a COVID pit.
Are you saying literal TP on a Native American or First Nation reservation?
Yes.
Wow.
I get those calls too, because COVID is rampant on reservations. I mean, think about this. I mean, and from their point of view, they're like, hey, you guys screwed us over 200 years ago when you told us to trust you. Now you want us to trust you again with this vaccine, and they're not having it. So that's taking a lot of education. And that is, Anthony, something else nurses do. We do a lot of education, patient education, and we're being asked to go into these reservations and sit down and talk with them about why they should receive the COVID vaccine. And again, you're putting yourself on the front line in a different kind of way. I don't think people look at all the facets of nursing. It's not just in a hospital anymore. We are everywhere. We're in government buildings. We're in airports. They're even putting them on planes. We're in pharmaceutical industries. We're in, I got a call from a manufacturing company up in Pennsylvania that wanted someone to come and just do vaccines. Nurses are being utilized everywhere. What you can do with this culture, continue to support us. When COVID started, the nurses were the heroes. Now you see that dying down. They're not so much the heroes anymore. So now we're back to it's Nurses Week. I think we deserve to be recognized more than 1 week a year, because nurses are the most trusted profession. You trust us. We just want you to keep trusting us and to empower us and mostly support us.
So how are we going to do this?
In my one of SETI's initiative is called in the health space is called iTelehealth, and it's technology based, right? Because we understand how technology is going to play such a huge role going forward in the future of how we deliver health services to the market, right? We've seen that, right? Healthcare, or the healthcare industry, was one of the last frontiers that have been slow to, respond to technology and having technology, transform the business, right? And if it wasn't for the pandemic, while telehealth, telemedicine was making stride and progress, the pandemic helped made the case why technology is needed, right? And so one of the things, Linda, and I want to say Sanette and Yvette, I want to be able to invite you guys to be part of the CASE initiative, and specifically the CASE Study EDU initiative,
Yes.
because there is an education component that is so critical to this process that I'm like dumbfounded that, how can we in 2021 have this kind of scenario that we're dealing with, and the only way we're going to effectuate change is if we, through education and information, to be able to empower people to understand what is it that they're dealing with. It's like the SWOT methodology, right? The strength, the weakness, the opportunities, and the threat needs to be applied across the board, because people should not be going into things, very cavalier, not understanding the severity and the criticalness of what is it that they're making the decision to make as a career or profession for the rest of their lives.
Yes.
And we don't want to have another situation in our workforce, and we already have it. We see this impact in the cybersecurity, just in cybersecurity within the IT industry. Think about it. There are kids right now who are going through STEM in the kindergarten and first grade simply to prepare them over the next 12 to 15 years to assume positions that 15 years later, we already know we're going to have a huge gap within these industries. Can you imagine? We're preparing for that workforce now with first graders and kids who are in elementary school. We have to figure out how to gain the trust of those who are coming into these professions and let them know that there's a risk in just about every profession. You walk into a high risk high school as a teacher, and you hope to leave that day with your mind intact and your body not bruised,
and be alive. And be
alive. But it is noble. It is really noble. I worked in a hospital as an executive, but I was so supportive of our nursing, our physicians, and you know what? And also our CNAs and can you give us kind of the whole, from the CNA that, we funded all these kind of training programs.
Yeah. Well, unfortunately, right?
Don't say it. Don't you dare say it. Don't you dare say that.
We're going to have to do a part two. We're going to have to do a part two to this, because This is so intriguing. This is so intriguing because again, SETI has a healthcare initiative called iTelehealth, but specifically, just like how you have supply chain and blockchain, we have a process called efficacy chain, specifically for the healthcare industry. And how do we apply the efficacy chain to be able to address some of the deficiencies, right, and the gaps in that supply chain of delivering healthcare services to the public. So, Yvette, unfortunately, the time is up, and we need to transition for segment.
He's like the Sandman. He just moves and takes us out, and just
no.
That's when it gets juicy. But we still love you.
No, but I
Anthony.
want to have you back as soon as possible. I'm
Absolutely.
We can get you back. If your schedule permit, get you back so we can continue this conversation because there's so much that we have to cover.
Absolutely, and I'd love for you to just speak with Sinette. Sinette deals with a population that is considered, when they get to her, they're considered the end of the line. She, deals with the last chance school. She's the last stop before we just write you off and say, you're not going to be a good person.
Yeah, we got to get to that.
So we got to get to that, Anthony. We got to get to that.
That's right. So
thank you, Yvette. We will definitely have Sinette back, and we appreciate you and have you back. And then we'll talk more about what Anthony shared in the CASE initiative, iTelehealth, and our case study, EDU, because you would be a perfect partner with us. We appreciate that.
Thank you.
Absolutely.
Thank you very much.
All right, folks, that's it. That has been segment number one, health and wellness on the Marketplace Reset and Jumpstart. I'm Anthony Weeks, and of course, my colleague, Linda Dorman. Until next week, we will talk soon.
All right. Yeah.